One of the things that I see is that as you get older, your teeth get darker.
So Neil, I think you're better placed to answer this question. For those of the older generation, what is it normal to expect and what are people more at risk of?
Thank you, Annie. So it's interesting as more and more people are holding on to their teeth for longer. Their oral health is really important and to maintain it. One of the things that I see is that as you get older, your teeth get darker. So your enamel gets thinner, so it's not so translucent, and your dentine becomes much more dense and dark. And as a result, people's teeth do get a lot darker. And they come to me and ask whether or not it's possible for them to have tooth whitening. And absolutely it is. It's a very safe procedure. We've been doing it for many years, and it doesn't matter what age you are, you can benefit from it. And it does make such a difference, definitely as you get older, because it can help your self-confidence, your self-esteem, and it just makes such an amazing difference to your smile to have whiter teeth. The other thing that we see is that teeth do move over time and they tend to drift forward, which can create bite problems. It can create problems in terms of cleaning. And a lot of elderly people are having orthodontic treatment now, adult orthodontics. And I say again, as long as your teeth are in a reasonably good state, you can have that kind of treatment and it can benefit you so much more in terms of looking after your teeth as you get older, because it not only looks a lot better, but you can clean your teeth a lot easier as well. And the last thing that I want to talk about is, as you get older, you become more at risk to systemic disease, things like diabetes, heart disease, strokes, even Alzheimer's. And we know that oral health is linked to these things. So as you get older, it's really important to come perhaps even more regularly for your checkups, to see the hygienist, maintaining good oral health so you become less at risk, hopefully, of those other systemic diseases.
Absolutely, and I think something also to mention is oral cancer is your increased risk from the age of 65 onwards. So even if you perhaps don't even have any teeth or you haven't needed work for a long period of time, it's still important to have those regular checkups because the dentist will do an oral cancer screening, and we know that detecting it early can significantly improve the overall prognosis.